I got a request to do a video on golfers and tennis elbow, which is a very common complaint that I see in the clinic all the time. So let's talk about it. As always, if there's a topic that you want me to cover, let me know in the comments down below and I'll do my best to make a video about it. In both tennis and golfer's elbow, the pain comes from repetitively using a muscle over and over and over again, and that eventually can cause micro tears in the muscle, which then causes inflammation and pain. Because these forearm muscles attach onto the elbow, that's why you experience the pain specifically on the elbow. So you might even experience some weakness or difficulty gripping too. And usually it affects your dominant hand because that's the one that you're using the most often and becomes overused. So what's the difference between tennis elbow and golfer's elbow? First of all, you don't have to be a tennis or a golfer to have this type of pain. It's just named that way because these issues tend to happen in these sports. It's been quoted that 50% of tennis players have pain from tennis elbow. Tennis elbow is also known as lateral epicondylitis. In tennis elbow, the pain is located on the outside of the elbow. The specific muscle that gets overused is called the extensor carpi radialis brevis, and that's responsible for doing things like this, which is wrist extension. If your work or your hobbies involves doing a lot of wrist extension or arm supination, which is bringing your hand up like this, then that can cause overload on the muscle. That muscle attaches onto the bone on the outside of the elbow, so if it keeps pulling and pulling and pulling, that is going to cause inflammation and pain. Usually this is seen in any sort of racket sports like tennis, pickleball, which is very popular these days, plumbers, painters, dentists, and sometimes even mechanics because they're turning a wrench a lot. Golfer's elbow, on the other hand, is also known as medial epicondylitis, and it's pain that's located on the inside of the elbow. This is often seen in baseball pitchers because they're doing a lot of excessive throwing, and during that late cocking and acceleration phase, that puts a lot of stress onto the inside of the elbow. In golfers, during that backswing and downward follow through just before the golf club hits the ball, there's a lot of excessive stress on that muscle that attaches to the inside of the elbow. The muscles that get affected are responsible for wrist flexion and also pronation. You might also experience some numbness and tingling in your ring finger and pinky finger because there's a nerve that's called the ulnar nerve that's nearby. There's some tests that you can do at home to see whether or not your elbow pain is coming from tennis and golfer's elbow. For tennis elbow, if you feel the outside of your forearm press firmly on that bony structure and that reproduces the pain that you usually feel, then there's a good chance that this may be tennis elbow. There's also a test called the Cousins test. Keep your arms straight, bring your wrist up, and if you experience pain on the outside of the elbow and that reproduces the pain that you're normally feeling, then that's considered a positive test and it's likely tennis elbow. For golfer's elbow, find the bony prominence that's located on the inside of your elbow. And if you press that and just press the muscles that are slightly away and that reproduces your pain, that's a good chance that it's golfer's elbow. Another test that you can do is you can straighten your arm out, palm up, make a fist, and try to bring your fist towards your body. And if that reproduces your pain in the inside of the elbow, there's a good chance that this is golfer's elbow. Also, if you're experiencing numbness and tingling in the ring and pinky finger, then in order to check to see if this is the ulnar nerve, you can tap on the inside of your elbow between these two bony prominences. And if that reproduces your numbness and tingling in these two fingers, then it's possible that it may be coming from the ulnar nerve. The diagnosis for tennis and golfer's elbow is based on history and also physical exam tests like the ones that we just did. Usually imaging is not needed to make the diagnosis. However, if the findings are inconsistent or it's still unclear of whether or not this is causing your pain, or if you had any trauma, then doing imaging would be helpful. An ultrasound can be done in the clinic setting, and that really helps evaluate what's the integrity of the tendon, are there any tears, is there swelling. X-rays are used to look at bones. So you cannot actually see the muscle or the tendon, which is the cause of tennis and golfer's elbow in the first place, but it is helpful to see if there's any arthritis or any sort of loose bodies. And an MRI can be used to see if there's any muscle or ligament tears, but usually this is reserved for if the pain is not improving with treatment or if there's been certain trauma. If you're having any numbness and tingling, sometimes a nerve study is done called an EMG or nerve conduction study, and that helps to check whether there's a pinched nerve that's in your elbow or maybe even coming from your neck. However, this is not a comfortable study at all because during this study, we provide electrical shocks and measure the response of the nerve. Also, there's some small needles that go into your muscles, so it's not really comfortable, and it's usually not done without trying some things first. The first thing that you need to do is give your muscles proper rest. Because this is a muscle overuse issue, if you keep using your muscles in the same way, it's just going to get worse and you're not going to allow them to heal. So if you're playing a lot of tennis or doing a lot of activities that's causing the pain to get worse, then take a break if you can. The next step is to reduce the inflammation, which is going to help reduce the swelling and pain. This is when we use things like NSAIDs such as ibuprofen and naproxen. However, if you're on blood thinners or if you have heart disease, kidney disease, or stomach ulcers, then you may want to avoid things like ibuprofen and naproxen. Alternatively, you can use a topical NSAID such as diclofenac or Voltaren gel. You can just apply that over your elbow where you're having the pain. And this topical gel has much less side effects compared to the pill because it doesn't go throughout your entire body. Also, ice is really helpful to reduce inflammation, and you can put an ice pack, leave it on for 15 minutes after you do any excessive activity or if you're having pain. Physical therapy exercises are the main way to treat these issues, and I'll go over those exercises and stretches in depth later in this video. You can also use a brace that's called a counterforce brace. So you can buy the brace on Amazon. The placement of this brace is very important, not on the elbow, but slightly further down. Make sure that it's tight. What this does is that it helps dissipate the force away from the injured tissue to the surrounding areas. And you can wear this brace when you're doing activity that tends to make your pain worse. You can use this for both tennis elbow and golfer's elbow. Another treatment option is injections, and there's two main types of injections. The first one is steroid. Now, steroid injections can be very helpful in relieving pain in the short term. However, I would not recommend getting regular steroid injections for tennis or golfer's elbow because theoretically, if you're putting steroid into a muscle and tendon, you can potentially weaken the muscle and tendon, and that can make things much worse for you in the long run. Another injection is platelet-rich plasma. This involves a blood draw, and the blood is injected into the injured muscle, and that helps restart the healing process and also helps with pain. However, in the United States, usually insurance doesn't cover it, and it can be a little bit pricey. The good thing about tennis and golfer's elbow is that the prognosis is actually very good. 95% of people get better without needing any surgery at all. And surgery is really a last resort option. With the surgery, they release the tendon and reattach it. Now let's go over some exercises that you can do at home to make your pain feel better. With these stretches, you should do them before any activity, before you go play tennis, before you go golfing, or doing any sort of heavy work. So the first stretch is the wrist extension stretch. Straighten your arm and bend your wrist back like you're trying to stop someone. Use your opposite hand with gentle pressure and pull all your fingers towards your body. You should feel the stretching on the inside of your forearm. Hold this for 30 seconds and repeat it 5 times. The second stretch is the wrist flexion stretch, and this is just the opposite. So you're gonna straighten your arm again, bend your wrist downwards to 90 degrees, and apply gentle pressure towards your body. Hold this for 30 seconds and repeat it 5 times. The next exercise is called the wrist extensor strengthening. So find a table, bend your elbow to 90 degrees and rest your forearm on the table. Then use slow and controlled movements to lower your wrist down for 3 seconds and then bring it up for 1 second. Down for 3 seconds and then bring it up for 1 second. Do this 10 to 20 times based on how your pain is feeling. If you don't have pain with this, then you can slowly advance the exercise by using either a light dumbbell, or you can even use a water bottle or any sort of bottle that you have at home and use that to help strengthen your muscles. The next strengthening exercise is the wrist flexion. Now this is the same thing but just opposite. So with this one, you're gonna flip your forearm and bring your wrist downward for 3 seconds and up for 1 second. Down for 3 seconds and up for 1 second. Again, start with 0 weight, and as you get better and stronger and have less pain, then you can slowly increase the weight by using something like a water bottle or a light dumbbell. Make sure you don't cheat with this exercise. People tend to lead with their pinky finger. Make sure you're just keeping everything nice and straight. The next exercise is called the forearm supination and pronation. Start with your palm facing one side and just rotate your palm facing upwards. Bring it back to neutral and then bring it downwards. Bring your palm upwards and then return it to neutral and bring it downwards. The key here is to go slow and have controlled movements. Start with no weight at all And then as you get stronger and your pain starts to improve, then you can slowly increase the weight. Do 10 to 20 of these, just depending on how you're feeling. The last exercise is the stress ball squeeze. So you can get a stress ball, or in my case, I have this grip trainer that I bought on Amazon. I'll link it down below. And this is just working on your grip strength. So just squeeze and then release. Squeeze and then release. And try to do that 10 times. Now let's talk about things that you can do to prevent this pain from happening again. The most important thing is having proper biomechanics. If you're having this pain from playing tennis, decrease the string tension and also increase the grip size. Make sure you have a proper backhand swing and you're using proper technique. Also, make sure you warm up before doing any activities by doing those stretching exercises that we did earlier. Also, take frequent breaks to stretch. For example, if you're a plumber or you're a mechanic and you're having pain, every hour or so, take a break and do those stretches. Also, ice over the activity that's causing your pain in the first place. This will just really help reduce the inflammation and the pain that you might feel afterwards. Now, there are other things that can mimic tennis and golfer's elbow. If you had any sort of trauma, it's possible you might have some sort of ligament injury, such as a UCL or an MCL injury, or even an avulsion fracture. In those cases, you definitely want to see a healthcare provider. Also, the pain can be coming from your neck because the nerves of the neck supply the sensation and strength down into the arm. So it's possible you might have a pinched nerve in your neck that's causing your symptoms instead. Also, if you're doing any sort of motions where you're extending and straightening your arm out a lot, the triceps muscle attaches onto a bone in the elbow, so it's possible that you might have something that's called tricep tendinopathy instead. That's when it's really helpful to see somebody so they can do a proper evaluation to determine the cause of your pain. Alright, I hope this video was helpful for you guys. Again, let me know in the comments down below if there's any topics that you want me to cover, and I'll do my best to make a video about it. Don't forget to like and subscribe, and I'll see you guys next time.